So just before I start, I'd like to thank my co-investigators, Kristen Linder and David Nicolau, for their help in this project. So we looked at 357 patients that came to the emergency department with skin infections at our hospital, Hartford Hospital. And we excluded patients that had necrotizing fasciitis or osteomyelitis because obviously those patients have different therapies, modalities going into it. And we wanted to look at a number of different things, one of which was how many patients get treated in the emergency department and are sent home, and what happens to them after they get sent home, and what happens to the patients that get admitted to the hospital, in the outcomes for them in both going home as well as being readmitted back to the hospital. So what we found in those patients is that about 70% actually are treated in the emergency department and go home, with the other 30% being admitted to the hospital. And then if you look at the patients that come back to the hospital, it's about 25% in both groups. So about 22% of the patients get admitted, go home on some sort of therapy, and then bounce back to the hospital. And about 28% who got treated in the emergency department went home, came back to the hospital later. And then if you look at those groups of patients, it's about 60% come back with skin and soft tissue infections, and the other 40% are coming back for other reasons, all within 30 days. And so what that tells us is that there's a lot of patients coming to the hospital with skin, but most aren't actually getting admitted. So when we develop resources for treating skin infections, we need to really direct resources at the emergency department and not just at the inpatient setting. And then we need follow-up for our patients that are going home, because with 25% or so of patients coming back to the hospital, they, in about half of those being readmitted, we're missing something on the outpatient side. We don't know what those things are yet. They might not be getting long enough therapies. They might not be taking their therapies. They might have access to therapy issues, and certainly with non-skin soft tissue related readmissions, there are other things going on with their comorbidities that might be leading them back. In fact, one of the things that we saw of the patients who got admitted to the hospital, 30% got discharged to a skilled nursing facility. So these are sick patients with chronic diseases that really need more resources, not just in the hospital, but outside the hospital as well.